10,000 years ago, someone drilled a hole in another person's skull. No anesthesia, no antibiotics, no idea what a germ even was, and the patient lived. You'd think that's impossible. You'd think a wound like that means a death sentence. But archaeologists have found the proof again and again, buried in the dirt. So how did any of this work? How did humans survive surgery before we understood the body at all? The answer starts with a skull. In 1867, an American diplomat and antiquarian named Ephraim George Squier was shown a skull from Peru. It had a rectangular hole cut into the forehead, the edges smoothed and rounded. At first, doctors back in New York assumed it was a war wound, something inflicted right before death. But the bone told a different story. The edges had healed. That meant the person had survived the operation and lived on for months, maybe years afterward. This procedure is called trepanation, and it turns out it wasn't rare. Paleopathologist John Verano at Chilean University has spent decades studying trepan skulls from ancient Peru. He's examined hundreds of them. And his research shows something remarkable. Survival rates improved dramatically over time, from around 40% in early trepanations to over 90% by the time of the Inca Empire. 90%. That's a better outcome than battlefield skull surgery during the American Civil War, performed nearly 1,000 years later, with steel instruments and a basic understanding of infection. How does a Bronze Age surgeon outperform a Civil War doctor? Practice, careful technique, and a strange kind of trial and error passed down through generations, patient by patient, skull by skull. Verano's research suggests ancient surgeons in the Andes used tools like Toomey knives to scrape away bone in thin layers, rather than drilling straight through, which reduced the risk of damaging the brain underneath. They also seem to understand, at least in practice, that keeping a wound clean mattered. Some skulls show evidence of what looks like herbal poultices applied at the site. They didn't know about bacteria, but they knew that some things helped and some things killed, and they paid close attention. Trepanation wasn't the only ancient surgery that worked. Halfway across the world and thousands of years earlier, another kind of evidence turned up in the ice. In 1991, hikers in the Alps found a mummified body preserved in a glacier. Researchers named him Otzi. He lived roughly 5,300 years ago, and his body carried something unexpected. Tattoos, dozens of them, clustered around his joints and his lower spine. Radiologist and paleopathologist Albert Zink, who has led much of the research on Otzi at the Urach Institute for Mummy Studies, found that many of these tattoo sites lined up almost exactly with areas of joint degeneration and arthritis, visible on CT scans of his bones. The tattoos weren't decoration. They were medicine, a kind of acupuncture marking the points where pain lived. Did it work? We can't fully know, but the pattern is too precise to be coincidence. Someone, 5,000 years before germ theory, was mapping the body's pain and trying to treat it directly. This is the pattern you find everywhere once you start looking. Ancient people didn't have microscopes, they didn't have anatomy textbooks, but they had something else: relentless observation repeated across thousands of lifetimes, refined by whoever survived to pass the knowledge on. Consider something even more basic: wound stitching. Sutures made from plant fibers, animal sinew, and even human hair have been found in mummies across ancient Egypt, dating back over 5,000 years. Egyptian physicians left behind written instructions in a document known today as the Edwin Smith Papyrus, describing how to close wounds, how to assess whether an injury was treatable, and chillingly, how to recognize when it wasn't. Egyptologist James Henry Breasted, who translated the papyrus in the early 20th century, described it as the earliest known surgical text in human history. Case after case, written with clinical precision, almost 900 years before anything comparable appears anywhere else. They didn't know about infection control the way we do now, but they knew wounds needed to be closed, needed to be watched, and that some injuries meant the difference between a warning and a death sentence. So why does any of this matter now? Because it reframes what medicine actually is. We tend to think of ancient healers as guessing in the dark, stumbling toward truths we only later confirmed with science. But the evidence tells a different story. It tells us that careful observation, done patiently across enough people and enough time, can get remarkably close to the truth, even without knowing the mechanism underneath. They didn't know why cleanliness mattered. They just watched who lived and who didn't and adjusted. They didn't know why certain plants reduced swelling. They just noticed and remembered and taught the next healer. Every technique we've looked at today, drilling into bone, tattooing pressure points, stitching wounds shut, survived because it was tested on real people, thousands of times over in conditions with zero margin for error. The ones that didn't work vanished, along with the people who tried them. The ones that did work got passed down, refined, and eventually, thousands of years later, explained by science that finally caught up to what practice had already proven. We like to imagine progress as a straight line, primitive fear giving way to modern knowledge. But maybe it's not a straight line at all. Maybe it's a very long, very patient argument with the human body, one that started long before anyone could explain what a cell was. And somewhere 10,000 years ago, a person woke up from a hole cut into their skull and lived.